Good afternoon, everyone. Thank you so much for joining us. This is Ashkan Lashkari, MOASC President. I have the privilege of interviewing our uh, researcher of the quarter. Our spotlight today will be on Dr. Aditya Bardia. He is professor of medicine in the Division of Hematology Oncology at UCLA. Recently moved to UCLA from back east. Uh, Dr. Bardia, thank you so much for joining us.
Thanks so much for having me.
So in this short discussion, our goal is to introduce you and your areas of research to our MOASC membership. And so our first question is, what are your areas of clinical research that you're focusing on? I know that it's in the area of breast cancer, but perhaps you can expand on that further.
Yeah, no, absolutely. Thanks for the question and the opportunity for me to highlight the ongoing work. So I've been involved in drug development of novel agents. I was involved in development of selective estrogen receptor degraders, elacestrant, as well as antibody drug conjugates, sacituzumab govitecan, datopotamab deruxtecan, and trastuzumab deruxtecan. And my personal research is now focused on antibody drug conjugates, development of these agents, and building on the previous results, combination of antibody drug conjugates with other therapies, and then moving them to early breast cancer as well. And as the program director, also involved in clinical research of other faculty members and building their portfolio in terms of their interest and other clinical trials relating to novel therapies, as well as survivorship and supportive care. So I'm very excited to be here.
That's fantastic. Thank you so much. So, on that note, of course, we've seen so much growth in regards to antibody drug conjugates. We're seeing it across so many different cancer uses. And of course, that seems to be a real big bright spot in breast cancer. Perhaps you can share with us some of the clinical trials or studies that you were participating or leading in regards to developing these ADCs.
Yeah, absolutely. The idea is to move these antibody drug conjugates to like first line MBC as well as to early breast cancer. And essentially in the future, hopefully replace chemotherapy, at least partially, if not completely. So there are three studies I would mention. The first one relates to sacituzumab govitecan in the first line setting for patients with metastatic triple negative breast cancer. It's the ASCENT-03 and ASCENT-04 study, building on prior results. The second one is with datopotamab deruxtecan, also a TROP2-directed ADC, but for patients with localized triple negative breast cancer, patients who have residual disease despite neoadjuvant therapy. That's an unmet need. And Tropion-Breast 03 is a clinical trial that's enrolling patients who have residual disease despite neoadjuvant therapy and potential access to datopotamab deruxtecan or Dato-DXd. And the third trial is an investigator-initiated study called the TALENT study, looking at trastuzumab deruxtecan or T-DXd, also for early breast cancer, but hormone receptor positive, HER2-low early breast cancer, where patients receive T-DXd in the neoadjuvant setting, so even before surgery. So these are different studies in different settings: MBC, early breast cancer, TNBC, ER-positive, all around antibody drug conjugates. And I'm very excited about these studies because they would help address an unmet need and also answer a scientific question.
It sounds like we're really moving up these drugs very quickly, and I think for a lot of our patients, this is very exciting. It's really, as you mentioned, building on a lot of the developments so far. Are you also looking at, and this is perhaps a slightly separate question, and that is, are you looking at combinations of ADCs as well, partnering with other agents? For example, not unlike the amazing success we've seen in metastatic bladder cancer, combining an ADC with like a checkpoint inhibitor. Are we seeing that there may be some synergy in breast cancer?
It's a great question. There are ongoing studies combining these ADCs with immunotherapies. For example, ASCENT-04 is looking at sacituzumab govitecan in combination with pembrolizumab, and similarly with other ADCs as well. So that's ongoing. But in the future, what I would like to see is combining these ADCs either with other ADCs or targeted therapies like PARP inhibitors, PARP1 selective, or other agents in the DDR pathway, given that a lot of these ADCs have topo-1 payload, so that could be synergistic. There'll be a challenge with toxicity, and that's why we would have to be creative in terms of how we combine them. But that's something I'm very excited about because mechanistically, it could improve the efficacy of the ADCs.
Well, I wanted to thank you so much. I mean, I think this is actually a small or a short conversation, but certainly a lot going on. And I think, both in the triple negative and in the hormone receptor positive space, there's a lot of positive, or hopefully some positive outcomes that we'll see, and hopefully soon, so that we'll see a greater change in the management of our patients sooner rather than later. Um, any final comments you would like to make before we wrap up, Dr. Bardia?
No, absolutely. That's why we are here. We are here to improve the outcomes of our patients, both in terms of survival and quality of life. So excited about these studies and appreciate the invitation and look forward to collaboration in the West Coast.
Absolutely. And I think that we're very lucky to have someone of your caliber in Southern California, being a thought leader and leading these important studies. So, our membership and those in the Southern California now, having another person we can really rely on, and so we all appreciate that, and thank you for your time today.
Thank you.